My name is Nimesh Patel. I'm a trauma and total joint surgeon at Panorama. While there are many kinds of arthritis, the primary arthritis we see here at Panorama is osteoarthritis. What osteoarthritis is a deterioration of our cartilage at the ends of the bone. So the cartilage is this layer at the end of the bone, which is typically nice and smooth. It's what provides a cushion in our joints. And as that wears out, which is what arthritis is, the joint becomes more painful because the smooth covering of the cartilage is now disappeared and exposing the bone underneath. So with that exposed, that becomes more symptomatic, painful. The joints are more stiff. The joints will swell, and these are some of the symptoms you'll appreciate or notice as the arthritis starts to form. Osteoarthritis can occur pretty much at any age. Primarily it occurs after the ages around 50 or 60, although in rare situations it is earlier than that. So osteoarthritis is typically considered as a wear and tear of the cartilage. So as the cartilage tends to deteriorate, typically we want to minimize the extra forces across the cartilage that might make it wear out faster. So for example, if someone was a big runner, we would recommend that you avoid those higher impact activities as to not further deteriorate the cartilage prematurely. While we still want you to be active and stay healthy, we would try to modify your activities to something where you're not causing the high impact forces across the joint, maybe swimming or riding a bike. Once you get osteoarthritis, again, the symptoms would typically be some pain when you're doing activities that you used to do without any limitations at all. And at first, sometimes you can just treat it with anti-inflammatory medications or just ice and any subtle thing that can help you feel a little bit better. Now, as that progressively gets worse, you'll notice that the treatments that you would typically use that would address the pain in your joints are no longer effective. So that will now limit how long you can go for a run or how long you can be active or anything like that. And as those symptoms continue to worsen, you'll find a point where you get nothing that's really very effective for you, and then that's when you'd want to consider something more, another kind of intervention which is more invasive, maybe like an injection in the knee joint, or ultimately eventually surgery if no other kind of treatment is effective for you. But essentially with osteoarthritis being a progressive disease, meaning it just gradually wears out with time, it's something that starts subtly and then gets more symptomatic as time goes on. Osteoarthritis can affect multiple joints. The primary joints it typically affects are shoulders, hips, knees, ankles. Frequently affects the hands as well. And we typically talk about replacing hips and knees and even shoulders because these are some of the larger joints. Patients respond quite well to those surgical interventions, so we can get them back active again. So after you've had a joint replacement, recovery is variable for everyone, but roughly I would say about 6 weeks, most people are moving around pretty well. Usually you'll still be working with physical therapy to get more mobility with your joints and get some of your endurance back. By about 3 months, the bulk of your recovery is done, but it's pretty well known that people will make improvements up to a year out in terms of their range of motion and overall activity level.